The implantable balloon technology that was recently made available in the United States in the fall of 2021 is an excellent new option for irreparable rotator cuff tears specifically. And I think in order to understand how this implant works and when we should use it for our patients, we have to understand what the rotator cuff does at baseline. And so looking at a shoulder model, there's 17 muscles that move this entire shoulder girdle around. And the rotator cuff are muscles that come off of the shoulder blade and wrap around the ball. And their main function is actually to compress the ball into a shallow socket and give biomechanical advantage and stability to the surrounding muscles to move our arm in space. And when our rotator cuff tears, our ball starts migrating around, loses stability and biomechanical advantage, and we end up with pain, a loss of range of motion, function, and strength. Rotator cuff tears can eventually go on to retract, atrophy, infiltrate with fat, and may become irreparable. And so the balloon technology has really given us an extra option in our armamentarium to address irreparable rotator cuff tears before considering the role of something like a reverse shoulder placement. And so what we do in surgery is we go in there and put a balloon on top of the ball and inflate it with fluid, and that helps keep the ball down, compressed within the socket, giving our soft tissues a chance to recalibrate and use physical therapy after surgery to start strengthening around the cuff tear and achieve improved range of motion, function, and strength. The balloon is biodegradable. It goes away within 9 months, and so the rehabilitation after the surgery is incredibly important, and it's a very rehab intensive process, and as such you need to have a very motivated patient, in my opinion, to move forward with this surgery. After surgery, we'll work diligently on shoulder exercises so that we have excellent control of our shoulder by the time that the balloon disintegrates, and we'll still have an excellent outcome long term.